Hello, my name is Steve Allen. I'm with the North American Institute, a faculty member, and I'm going to demonstrate with Sean here today a traumatic arthritis suspect right lower lumbar spine. The mechanism is going to be a blow that would throw him into that quadrant, either from perhaps an athletic endeavor, being clipped or hit from the side, a car wreck that would throw his back into that direction. We're going to set this up as a subacute state, so he's out of that high irritable state and resolving into the presentation I'll show you. So what I'm going to do is set this up for the pain provocation on an H and I quadrant. So the I quadrant in the right extension is going to be challenged in side bending on this will actually be the H coming back into extension. That would be provocative and likely limited, reproducing his pain. Same way, if I bring him into on the I quadrant, back bend, and then into right side bend, bringing that pain up immediately again, no matter which vector I take, we get that provocation. The relevance in this subacute state is to confirm consistency with compromise and limited closing ability somewhere in the lower lumbar spine. So from there, we're going to go to a prone position and look further at this particular injury. Okay, so we've moved Sean further in our assessment into this non-weight-bearing prone posture, get him as comfortable as we can, and my provocation is a torsion test. In this case, using my hand to come into the innominate and impart this torsion, which is essentially lifting the innominate into right rotation. We reference the superior segment in the torsion test, so this is a left torsion stress to the lower lumbar spine. And that will be provocative with the closing lesion that we talked about in standing, the suspect injured zygapophyseal joint, lower lumbar spine. Left torsion provocation. And to help confirm that further, on the opposite side, a right torsion test would result in a gapping effect and an opening effect on the right side, so that would be less provocative if not provocative at all. So left torsion. We'll take this further then with our PA by localizing via surface anatomy. I'm going to use the PSIS to get me as close to S2 as a reference point, and then I'll just palpate to 1 and then 5, 1, so the small P-shaped spinous process L5. I'm just going to take his leg and I'm going to do a little extension. So I'm just lifting to confirm that that is a mobile segment and I'm not at S1, 2 and L5, S1 right here. At L5, S1, if I stay interspinously, so I'm not at the level of the spinous process, but if I stay interspinously and go lateral about 1 centimeter, that's going to put me over the zygapophyseal joints. If the right L5, S1 is provoked with my PA now at this point, so I can actually apply a little bit of pressure, and if that's provocative, combined with the other two tests, it would just raise the index of suspicion that that is the mechanism and the source of pain in this lower lumbar spine post-trauma. Okay, so now let's take a look at the model, and we'll look at the torsion test on the model as well as our PA pressure unilaterally over the target joint. So on the torsion test, essentially took the innominate, stabilized the lower lumbar spine. At this point, I'm just going to look at L4-5. We looked at L5-S1, but with this plastics model, I think it's going to be easier to come up to 4-5. So basically, I'm going to stabilize on the segment at 4 and lift the innominate. And the effect will be a closing or a compressive force, which is non-physiologic, but that's what the torsion test is for provocation. And that would be the left torsion test that we just showed on Sean. The other thing we did was we went interspinously. We were doing it at L5-S1. At L4-5, for example, I'd be right here, and I would fall off that gap and come over then the L4-5 articulation on the right side. So I did my PA over the zeg joint, which is about 1 centimeter off center interspinously, making sure I'm not coming off the spinous process itself, which puts me between the joints. So interspinously, over the joint, and provocation with posterior anterior pressure.